Hey guys, my name is Haley Tahara, and I will be talking to you about a healthcare issue that I think is very important in today's society. So, I want you to imagine a world where doctors actually cared about their patients and how their patients were feeling, rather than just come in the room and listen to some of their complaints and then just prescribe drugs. So, most Americans do not even spend more than 15 minutes in the room with their own doctor. Most of the time, it is spent waiting in the lobby, waiting in the room for the doctors to come in, then listening to the doctor for like 5 to 10 minutes, and then the doctor leaves and has a nurse come in to prescribe the drugs. So, a current issue is that many patients do not feel safe in going to hospitals or even talking to their doctors. This one case that was written in the Kaiser Health News article was talking about how 15-minute visits take a toll on the doctor-patient relationship. It says that this one patient named Joan Einstott did not even spend more than 4 minutes with her physician. Her physician listened to her complaints and then prescribed a medication, but when the patient said that she didn't want to take that medication or that medication wasn't correct for her, the doctor completely cut her off and she didn't even go back to see him because he was so upset about how she reacted to him prescribing her this specific medication. I believe that many patients have the right to choose what they want to take and what they feel okay with taking. This other article written by the USC News stated that many patients also feel as though they are stereotyped before they even walk through the doors or see their own doctor. This is due to race, ethnicity, age, social economic status, or even if they have insurance or if they don't have insurance, which I do not think is right. I know that many people cannot afford insurance because healthcare is an expensive cost, and especially if you do not get your health paid for by your own work and you have to pay out of pocket. Many people who have to pay out of pocket can't afford to pay $700 a month just to have health insurance. They struggle to make ends meet, and they would rather put food on the table for their families rather than pay health insurance because, let's face it, no one really uses their health insurance unless they're actually sick and in need. I propose a solution for this issue, which would be that doctors are not subsidized based on how many patients they see a day, but rather than get paid to see many patients, they get paid to actually treat and diagnose the underlying issue and not just the symptoms. This would in turn help make patients feel more satisfied with their treatment and happier. Doctors also should not prescribe that many drugs to their patients because when you just prescribe drugs to patients, they feel as though they are addicted to them or they can get addicted to them, which in turn will lead to another issue at hand. Opioid addiction only takes a few days, and maybe you can get addicted in a week, which is creating a larger issue in our society today. When I was researching, it also said that many physicians are told to only see patients for under 11 minutes, so their scheduling is booked at least every 15 minutes because they're only allowed to allocate 11 minutes to each patient, which I do not think is fair to the patient or the doctor. Doctors who have to limit how much they spend with each patient are not happy, and neither are the patients. So, in fixing this healthcare situation, by reducing the amount of prescription drugs as well as allowing doctors to spend more time with patients by just talking and listening to the patients and trying to figure out what is actually wrong with them will help make the healthcare in America a lot better. Thank you for listening.